Some of the most important risk factors for pressure injuries developing in the OR, the main one is the length of surgery.
The research has absolutely shown that the pressure is the problem. That's why they're called pressure injuries to begin with. And what happens in the operating room is the pressure may not be particularly intense at the beginning of the case, but as the patient lays on that foam operating room table, their body weight compresses the foam down to where it becomes a harder surface than it was at the start of the case. The biggest culprit in the operating room, though, is the duration of time.
They also had to look at the patient's BMI. If the patients have a high BMI or a low BMI, they were at risk. They have to ask the patients about their history of skin injuries. The other thing that surprised me is the degree of patients that we had that were high risk. It was about 25%. It continues to be about 25% of our patients are flagged as high risk for skin injuries.
It's also very important for the pre-op nurse to do a skin assessment before surgery and also do a risk assessment, the Braden scale, and communicate that to the OR team. This patient is an increased risk of developing pressure injuries on my unit because of this. Their nutrition level is bad. Also, they have an existing pressure injury, and hopefully the OR will take note of that and try to keep the patient off that area as much as possible.
The prone position is actually considered high risk in itself because your patient has a lot of pressure areas, a lot of areas on the face. They have the clavicle, they have the sternum, they have the hips, they have the fronts of their feet, their knees. So there's a lot of different areas on the prone patient that can be pressure areas for them.
I think if you looked at a hospital today, you'd probably see a banner somewhere in that facility saying, "We are taking patient safety seriously. We are rated #1 in our state in patient safety." I think everybody's on that same pathway of making this experience as safe as possible for the patient. Pressure injury is part of that profile.
The thing that you can't put a cost on is the patient's pain. And the statistic that I've heard many times is about 60,000 patients a year die of complications of pressure injuries. So that's something that I can't put a monetary value on, but we have saved a lot of money through cost avoidance with our program.
Pressure injury development in the operating room is a real thing. But the nice part is the risk is manageable. It's not a risk that we have to say to the patient, "I'm sorry, you have this risk, we can't change that." You have a risk for pressure injury and we can prevent it. We have the right dressings.